Hey there. I am Mike, the Neuropathy Nurse. That just shows you that this is live and recorded. I'm Mike, the Neuropathy Nurse. And before you even think you know what I'm talking about, just stop and listen for a second. The topic for today is why you feel symptoms, why your neuropathy is causing you pain, tingling, numbness, balance issues, and just a miserable time in life at most turnaround times. So, you may have neuropathy or the understanding of neuropathy because you have diabetes, you've undergone cancer treatment, maybe you have taken statins for cholesterol, you have a back injury. The Another reason is idiopathic. We don't know why you have it, you just have it. Okay, so I'm going to explain to you right now, if you give me a minute or two, exactly why you feel the symptoms of peripheral neuropathy and exactly why you can feel better. All right, so here we go. Irregardless of the cause of peripheral neuropathy, again, there are 100 different causes of peripheral neuropathy and millions of people suffer from it. But irregardless of the cause, what all of those things make happen is they cause the little blood vessels around the nerve cells and the surrounding tissues to start to shrink up, right? So they start shrinking, right? This can happen really slow, or this can happen really fast. Like in chemotherapy induced neuropathy, this happens pretty fast. But in all those cases, again, those blood vessels are shrinking up, right? So, did you know that our bodies make new blood vessels every single day, right? We get a cut and the blood flow comes back. Hearts, they make collateral circulation and so on and so forth. It's a process our body performs. The big fancy name for it is angiogenesis, but not many people know that. So we know how the body performs that function, right? We eat and drink things that provide our body with the ingredients, the minerals, the trace elements for a substance that's required to trigger new blood vessel formation. Right? That substance, it's called nitric oxide, by the way, for the most part, among other things. I'm giving you a 30,000-foot view here. I'm giving you what you need. If you need to know studies, double blind, this, that, or the other, well, then perhaps this condition is not really affecting your quality of life that much yet. So basically, we eat things, we go out into the sunlight. Sunlight makes vitamin D, and it has a whole host of other natural, wonderful properties. It's also got a bunch of bad rays in there too that we try and avoid. But certain wavelengths of light actually then cause that substance to release and initiates new blood vessel formation. Awesome. The only problem is understanding that peripheral neuropathy, this condition, right? This is a progressive condition that will not stop. All right? Unless you get the proper treatment, this condition will become debilitating. Right? And the proper treatment, if we understand that the reason we feel symptoms is because we're losing blood flow and our cells can't breathe, well, just ask yourself this. When you're medicated for pain, does that help grow new blood vessels? When you're medicated for depression, that doesn't grow new blood vessels, right? When you're medicated for anxiety, when you're medicated for sleep, that doesn't grow new blood vessels. All right. So there is hope. There is a process that is used by, over 1,000 providers across this country who can naturally, without drugs, surgeries, or injections, re-get that circulation back to your nerve cells and surrounding tissue. It reprograms, basically retrains the nerves to handle the impulses properly, right? Because they're going to start working better again. And then they help you put the body in the exact right spot, right? For optimal health, optimal healing of nerves. So I'm happy to help anyone with any information. I have nothing to sell you. I'm a nurse. I've been in healthcare for 40 years. I've been a patient advocate my entire life. And since I've known about these procedures, it is my duty to share it with anyone who wants to know the truth about reversing their peripheral neuropathy and ultimately get a glimpse into the truth about our current state of our healthcare system that uses an acute care model to treat chronic conditions, right? We must reverse the root cause of conditions so that everything that would normally follow can't. I am a root cause healer who works with other root cause healers to change the world in healthcare and give you your life back. So if you have any questions, please DM me, right? I'm happy to help. I'm happy to find you a provider in your area. I know hundreds, if not thousands of them. So listen, don't give up hope. There is hope. I understand you're skeptical because that's because all the things that just treated symptoms didn't work, right? It didn't work. So let's chat. All right. Peace. Love you guys. All right.